Okay, welcome everybody. So we are here today for a group Safe Streets Group Leader Forum and COVID-19 update session. And so my name's Eric Hasted. I'm a community mobilizer with Safe Streets. And if you have not noticed, then we are recording this meeting. So if you are uncomfortable with being recorded or you would not like any of your information available, you're free to hop off the call, and also you're free to keep yourself muted and your video off. That's probably going to be the best way to maintain your privacy. Otherwise, though, this is just going to be for Safe Streets purposes and usage, and it's not going to be, put out into the ether. Just as kind of an overview of what the agenda is going to look like for today. From 4 p.m. to 5 p.m. is going to be a presentation from Dr. Anthony Chen. And so he's from the Tacoma Pierce County Health Department, and he's going to talk about some of the county efforts to address COVID-19, as well as some of the temporary shelters that are being looked at to be put up throughout the county. That's going to be followed by some question and answer, which we will try to end as close to 5 p.m. as possible to honor his time and your time. Following the question and answer portion, we will be going on to have some updates from Safe Streets, as well as for group leaders to give updates about what's going on in your neighborhoods. Something to note is that I'm going to go ahead and mute all for the duration of this duration of the presentation up until the question and answer portion. So I just muted you. So if you see that update, that's what it was. I just wanted to go over really quickly for anybody that's not familiar with Microsoft Teams, what some of the controls look like. So I'm going to go ahead and share my screen to start. And so people should be able to see my screen now. And so I just wanted to bring attention to specifically on down here, you have your individual command bar. You're not going to have a couple of the things that I have because I'm the organizer, and I'm currently hosting the screen. However, if you go to this button right here, it's the leftmost button. That's to toggle your camera on and off. So whether or not you'd like people to be able to see your beautiful faces. The next one is going to be the mute unmute button. So at the moment, I'm the only person able to talk, but I'll have Dr. Chen unmute himself in just one moment. And then once we get to the general shareouts, we're also you're going to be able to unmute yourself to be able to talk. One kind of common courtesy that we tend to do on online conferencing is that if you're not actively speaking, I ask that you do keep your computer muted, just so that we don't get any of that weird background noise. For anybody that's calling in from your phones and you can't see any of the stuff that I'm talking about, to be able to unmute yourself, you just push *6. And so once we get to the question and answering portion, I'm going to have all of the questions be filtered through the chat. And so in order to show chat, you would go to this button here, which shows your conversation, and then you can type into chat. Feel free to write down any questions, insights, whatever that you have during Dr. Chen's presentation. And then some Safe Street staff members will be monitoring that chat to be able to pick out the questions. So once we're at the question and answer portion, we'll make sure not to miss anybody. During the question and answer portion, I will be sure to call out, have an opportunity for anybody who's calling in to be able to ask any questions that they have, because obviously they can't type into chat. So I just wanted to let you know for that. And then lastly, under this last button is show or hide participants. You can see who's a part of the call. And of course, hang up whenever you feel like you've gotten all you want out of the call. Feel free to leave. We don't want to keep anybody later than you're available for, and this is really just as long as you are available. And so with that, I'd love to be able to turn it over to Dr. Chen, who's going to go through a short presentation, and then we'll be able to get some question and answers going. So Dr. Chen, it's all you.
Great. Good afternoon, everyone. Let me know if you cannot hear me well. I know when I tested earlier, it seemed like Eric could hear me well. What I'm going to do right now is I'm going to share my screen so I can do this presentation with you. Great. Okay. Can you all see my screen now? Okay. Okay. So Eric, you can see the presentation, correct? Okay, so give you some background about what's going on in Pierce County. The transmission of this virus is quite widespread right now. It's in pretty much every corner of our county. As of April 11th, Washington State has had 10,400 cases and 500 deaths, and about 88,000 total tests as of April 3rd. They're a little bit behind now. Their computer systems having some problems in terms of the more recent reporting. And up to that point, it was 8 or 9% positive out of all the tests done. Here in Pierce County, as of today, we have 969 cases and 20 deaths. Again, there's some delay in the state data reporting system. Last that we knew is about almost 9,000 people have been tested. You may have heard that a few weeks ago we did a drive-through testing site at the Tacoma Dome, and at that event we administered about 1,000 tests. Overall, our positivity is about 5%, which is lower than King and Snohomish counties. So here's a graph that shows you the blue bar is the total number of cases that we've had in Pierce County. The green line are the new cases each day. You probably cannot see the really fine print, but yesterday we had a little dip down, which we think is a technical error. But other than that, if you look in this time period here, going all the way back to the 5th of April, we've really been bouncing around the 30 to 45 cases per day range. So that's good news, because if you look before that, like here we had 65 cases a day, 51, 70, 80. So we have come down from the more rapid increase in cases. So the good news is at least we're kind of bouncing around here about 30 to 45. But keep in mind that that's still 30 to 45 new cases a day. So we're now, basically a straight line linear increase in our cases. So we've not hit the peak yet because we're still going up. But it looks like we may have flattened the curve. This gives you an idea of what we did at the Tacoma Dome. So almost 1,000 people were tested. You'll see here that out of that, only 2% were positive. If you remember earlier, I said out of all our tests, we're running about 5% positive rate. This happened to be lower than that rate. But you can see this is who we tested. About half worked in healthcare settings. About a tenth were in public safety. About half were in providing some kind of critical services. Now this, because we've had some limits on the amount of tests that we've been able to do, we tried to restrict it to people who either are at high risk due to their work or are at high risk for developing complications. So here you see, for example, 13% of these people were older than 60, about half had underlying medical conditions, 1% were pregnant. Just give you an idea down here, these were the symptoms they had. A quarter had a fever, almost 90% had a cough, about half had shortness of breath. I know there was a lot of interest in Tacoma about what we were going to do with the remaining 1,400 test kits from that. After some negotiation with FEMA, they did allow us to distribute them locally. You can see that out of about 900 of those, we want to make sure that they got to places that really needed to have the test. We know that long-term care facilities, so these are like skilled nursing facilities, adult family homes, are at very high risk for outbreaks, as people have seen up in the Life Care Center in Kirkland. So we made sure that a bunch of those kits went there. The federally qualified health centers, those are Community Healthcare and CMAR. Some of you may have seen some of the notice from Community Healthcare. They have now announced that they're going to be certain of their clinics will be doing free testing for COVID-19 coronavirus. We also are making sure that first responders are getting some of this. One of our concerns was to make sure that people in rural areas, so that is on both ends of our county, and also people who might be seeing smaller physician practices have access to this. Out of this, we sent 70 to Puyallup Tribe. We actually have sent some more, actually about double that number to the Puyallup Tribe, because they do have a nursing home, and we want to make sure that they had staff for that. And you can see the other 500 were designated for rural clinics and healthcare system testing. You may have seen this curve before, or this graphic before. Everyone's been talking about flattening the curve. This is what we're talking about. So that purple curve is if we didn't do anything. You can see earlier you heard me talking about rapid increase acceleration, and in cases like this, the increase is exponential. So it increases by a certain percentage every day. You can see it very quickly goes up very high, and then it comes down. If you imagine that there's a line somewhere here, if you would draw a line somewhere here, that's the number of beds we have in the hospital, the capacity of a healthcare system to do it, to take care of these people. And you can imagine if we all of a sudden got a huge number all at once who are very sick, we would be in a situation like New York City was, where they were just running out of ventilators, hospital beds, ICU beds, and so on. So what we try to do is flatten that curve so that, this may not mean that we see less cases, but we're seeing a more gradual increase in the cases. It peaks out below whatever that line is of the hospital capacity, and then it stretches out, right? So we may avoid cases, or maybe we're just delaying the cases, but we're not overwhelming the system. So I know a lot of interest, both with Safe Streets as well as people in the community, about the temporary care center that we opened down on South Hosmer Street. This opened on April the 8th, so this past week. And I know there was a lot of concern about what it was doing. The importance of the temporary care centers is that we know there are going to be some people who need to stay at home to either isolate or quarantine themselves. And we don't want those people going out and getting other people infected in the community. And while many people can do this safely at home, there are some people who, maybe they have an elderly parent at home, a child with asthma, that they don't want to get them sick, or maybe they live with some roommates or live with a relative and it's not convenient for them to be staying with them. And certainly there may be some people who don't have a home. They might be living homeless. So we want to make sure that everyone in Pierce County who needs to be isolating or quarantining themselves be able to do so. So just to let you know how this works is that when people may be a candidate for this facility, that they need a referral, we will screen them. The sites are intended to reduce the pressure on the hospitals. It also is to make sure everyone in the county has an opportunity to have a safe and supported place for them to observe up to 2 weeks where they're staying away and preventing other people from getting sick. The original intention was that the county executive outlined a plan for us to have 3 sites in the county, one in kind of East Pierce, one in Central Pierce, and one in West Pierce. And the Tacoma site was the first one to open up, and we will continue to plan for the other 2 sites. It does not look like the demand is quite as high as we anticipated. So, but we're still going to continue to plan on that. Whether we open them or not, we'll just have to wait and see. So some more details about the temporary care center. The facility is leased by the county. There's no cost to guests or to the community that's hosting the center. The people are assigned individual rooms. They're expected, once they check in and are escorted to their room, to stay in the room. There is security on site 24 hours a day. We do not allow people to come and go. There are no visitors allowed. We do have some medical services on site, and we'll have capacity to manage some mental health issues. They will get 3 meals a day. Their laundry will be done for them. We will monitor them in terms of making sure we know how many people are in the site, what their health status is. And certainly with some of you all, we made sure that we work with the communities and understanding what this was. But then also if we are having some culturally or linguistic diverse clients in here, that we're taking care of them properly. And this we anticipate will be paid for with federal funds through FEMA and the federal government. So going back a little bit as to what we will be doing in this site, it's to make sure we have a place where people can undergo assessment and recovery. You will hear people talk about these two terms, quarantine and isolation. These are both very important for us to control the spread of the coronavirus or COVID-19 in the community. So when we're doing assessment or when people are undergoing quarantine, that means these are people who have come in contact with someone who has COVID-19, but we don't know if they're going to get sick or not. But certainly because some people can get sick or they can start shedding the virus and be spreading the illness before they realize they're sick, we need them to stay away from other people, and certainly for a duration of about 14 days in this case, to make sure that they're not inadvertently getting other people sick. In isolation, on the other hand, we're talking more about recovery. So people who are asked to isolate are people who have the disease, but then in this case, they're not sick enough, for example, that they need to go to the hospital. So again, this is a more clear case where we want them to stay away from other people so they don't get other people sick. And typically we would say they would need to stay there for 7 days or 72 hours after the fever and other symptoms have gone away, whichever is longer. On the other hand, there's something else that sounds a lot the same, but serves a different function. So we were working on temporary expansion shelters, and these would be resources for people living homeless so that they can be socially distanced, so that they're not having rampant, spread of the disease. We already are working with homeless shelters to, as well as the city and the county's human resources to coordinate needs and place in an expansion shelter. So these are for people who are living homeless, who have symptoms of COVID-19 or positive for COVID-19, and they need to, undergo isolation or quarantine. So this is a slightly different population. So while some people who are homeless may be in the temporary care center, the temporary expansion shelters are really for the population that already normally would be using shelters. And as you know, they may also have coexisting mental health or substance abuse issues. So those of you who want to keep up to date as to what's going on, you can go to this page on our website. Allows you to sign up for health alerts. Right now, most of the health alerts are around COVID-19. Rest of the time when we're not during COVID-19, you would get notifications, for example, around restaurant closures and other ongoing public health issues. So if you want to learn more, here's a good web page. It's our website, www.ttchat.org/coronavirus. And there's my email if you need to reach me. So with that, I'm ready to take some questions.
All right, fantastic. So the first question that we have in chat is from Emmy. And so she asks, for perspective, just wondering how many COVID-19 deaths we've had in Pierce County versus the number of deaths of the flu last year or in recent years during the same time period.
Right, so right here, on this slide, you see we've had 20 deaths in Pierce County. Now the number of cases, so we're just shy of 1,000 right now. So the number of cases is low, much lower than we get during a flu season. The number of deaths is now higher than what we got last season. Now, this varies every year. So, for example, 2 years ago, we had a really bad flu season and the number of deaths was higher. Um, in general, what we think the fatality rate of this, well, so there are two things, right? There's how infectious is it and how deadly is it? So in terms of infectivity, it is about as infectious as the flu, right? So if you think about, during flu season, which typically lasts into April, how many coworkers or friends you have who get the flu and get sick. That's about how well it'll spread. The difference is that with influenza, there is a vaccine for it. And also people, because even though the virus mutates every year, there's typically some cross-reactivity. So there's some people who are already immune to it. With coronavirus, this is a new virus. So there is no immunity in the community. There is, other than people who've gone sick already and have become immune, we don't expect anyone to be immune to it. There is no vaccine for it, or at least probably not for the next year or so. So we will expect that this number will continue to go up. So the infectivity is about the same as the flu. The death rate, you may have heard, some people think it's about 10 times as deadly as the flu. Other people have said, well, this might be more like a really bad flu year, which, as I mentioned, about 2 years ago. I think at the same time, you've also heard about the 1918 flu. So this is probably about half as deadly as the 1918 flu, but we're not going to know for sure until this, until we're further along in here. One thing to notice is, if you look at this number, right, in Pierce County, there are roughly, 880,000 people. So we're talking about 0.1% of the Pierce County population has gotten sick so far, or at least that we know about, right? Even if you say, well, maybe we missed 3/4 of the cases, that's 0.4, or if we miss 10 of the, we're only picking up 1 out of 10 of cases, then we're talking about, maybe 1%. So that means 99% of the people who live in Pierce County have not gotten the coronavirus, COVID-19 yet. So we still have a ways to go. I mean, the good news is that at least 80% of people are going to do fine. They don't have mild illness. So that's a very long-winded answer, but just to say right now we've got a little bit more deaths than we've had from the flu, but this will probably just gradually increase as we get more cases in the county.
All right, great. Thank you for that. And just as a reminder to any of the attendees, if you have any questions that have come up, including Safe Street staff, if you have any questions that have come up during the presentation or in response to some of the other questions that have been happening, please do feel free to respond in the meeting chat. And then I will be sure to provide some time for anyone calling in to be able to ask those questions as well. So the next question was actually mine, and it was during your slide on the homeless expansion shelters. And so my question was, if you could go a little more specifically, what does the support for homeless service providers look like? Are the expanded shelters separate sites, or is it just additional financial resources to existing shelters to expand their beds? I was just looking for a little more information about that.
Right. So I did talk about temporary expansion shelters, but then in the kind of behind that too, there's been a lot of work we've been doing with the homeless shelters. So as you know, one of the really key things in all of this is hygiene, social distancing, right? So we've been providing support to the homeless service providers. You may be aware, for example, like Nativity House and the rescue mission, they have moved to, rather than sit-down meals, they're doing handout meals. They're trying to space people further apart. My understanding is the rescue mission, for example, normally can sleep 150, 160 people a day. But if they were to observe all the social distancing recommendations, 6 feet apart, it would cut their capacity to like 50, right? So the other 100 would need to find somewhere else to go. Now, fortunately, Bellarmine did reach an agreement to house some of the rescue mission people there. We were also fortunate that the Salvation Army had a shelter which they had closed, but they were able to reopen. The one new site that we brought on as a temporary expansion shelter was NBC, opened up their site on Tacoma Avenue, which I understand most recently was being used as kind of their youth day center, the homeless youth center. And so that's been operating. We have a short-term contract for them, which will end tomorrow. We're in the middle of evaluating the need for that. So that was the one temporary expansion shelter. Well, I should say that one was for a little higher level because they did provide some services, but like the Salvation Army, that was some expansion. The use of Bellarmine, that was an expansion as well. But we're evaluating whether we will continue the NBC contract. And some other things that both the city and the county are working on are, my understanding is law enforcement has, for the moment, decided not to do any homeless encampment sweeps. It just is not a good thing to be breaking these places up when there's no place for these people to go. They also, the human services departments have been working at making sure there's more sanitation. So, porta potties, hand washing stations, things like that, to ensure that people, even though they're living homeless, still have ways to maintain sanitation. Important thing to remember is that we also do have a hepatitis A outbreak that's ongoing in some of these homeless communities. So that as well is, it's very important for us to make sure there's sanitation and hand washing for those. I think I was pleased to see that in Puyallup, that when their day center closed, the New Hope Center, when that closed, and also their Freezing Nights program, which was being run through the churches, closed, and those living homeless ended up pitching their tents along the river. The city of Puyallup did respond and created a temporary site for them at the Puyallup Recreation Center, where they're being allowed to camp in the parking lot. So that certainly creates some capacity outside of Tacoma, right, which is very important for our county.
Great, thank you. So the next question is from Sarah from the Safe Street staff, and that question is, what is the capacity of the temporary center in Tacoma?
I believe we have like 100 beds in there, but we have a lot of space. So if you're familiar with that hotel, it's a good-sized hotel. We're not supposed to say what it used to be because the national chain doesn't want us to mention their name. But you all know where it is. It's a good size. We have lots of space in there. If you know of people, in fact, it would be very important. I mean, the money's spent on it. Okay, we've leased that site. We need to use it. So if you know people who fit in some of those categories I mentioned, who they've been exposed to COVID-19 or they've been diagnosed with COVID-19, and they need a safe place to go, either because of their family situation or now increasingly, people are talking about people who are in like bad relationships and domestic violence situations. That might be another place that we could offer them a place to go, because we know that when you're kind of locked in indoors with in that situation, the chance of domestic violence goes up, right? So Make sure you contact us or work through human service providers if you're aware of people who could use this space. We have plenty of space, and we're ready to take on more people.
Okay, the next question is from Wanda with Safe Streets, and that question is, what do you say to people that appear unaffected by this virus and get them to take the social distancing seriously?
This is a hard one, right? I mean, I think we've all seen the pictures of spring break in Florida where people were shoulder to shoulder and, doing all the things that young college kids do. There's some people who just feel that this doesn't affect them. And I think it's really about us continuing to, and it's not just me, right? I mean, some people will listen to me. Other people just think I'm, a talking head from the government bureaucracy. People like you have a lot of influence in the community. And it's important for you to mobilize your community network to help people understand that this is a serious issue, right? As I said, 99% of the people in Pierce County have not gotten this illness yet. When you think about that, that's a lot, right? I mean, that's like 800,000 people. And if they all got sick on the same day, it's bad news. And I think all of us, right, we have parents and some are older than others, or this recommendation about people over 60, right? I mean, I've talked with like some of the nonprofits and they're saying, wow, all our board is over 60, or we have many employees who are over 60. That was one of the problems for the schools was, I think people weren't aware, but the first schools that closed up in King County, so like Seattle School District and I think Highline and Lake Washington, the reason they closed was the absenteeism rate among their employees. They had so many bus drivers, teachers, teaching assistants, aides, kitchen workers who were over 60 or had a health condition, and they were staying home because they didn't want to get sick. Well, you can't run a school when you don't have people, right? So, yes, absolutely. If you all could work through your social networks to let people know this is serious, you can see that our curve is starting to flatten, but when you've got 99% of people who still haven't gotten an infection yet, you've got to keep this going. I mean, on a beautiful day like this, and we're going to hit 70 degrees probably later this week, people think, wow, they could just go out and play. Yes, get out and play, but stay socially distanced, right? and go out to exercise. Don't go out just to cruise the streets or, go visit your friends. So it's very important that we work on that, established as a social norm, and to make sure that we kind of encourage each other to enforce that.
Thank you. I definitely hadn't thought about it yet that 99% of people haven't gotten infected yet. So that's pretty humbling, I think. But the next question is from Mary Beth. And the question is, if we maintain prevention habits as they currently are, is there any projections on how long we will need to be quarantined and doing modified support of families?
Wow, wish I had that information. Let me get to that flatten the curve, right? I hope we're somewhere here, right? That we've flattened it. But you can imagine the moment we lose discipline, this purple curve will just start over here, right? So this is a really big area of conversation. No one knows the answer, right? I think China just opened up their cities, the ones that were locked down. They just opened them up in the past week or two. Places like Italy that have been hit really hard, they're not sure how they're going to come out of it. I think this is something which maybe at the end of this, if you all can give me some feedback, how do we turn the dimmer switch back up, right? So when we impose all those things like close down everything except essential businesses, ban big gatherings, so it's like flipping the light switch off. I mean, it was hard on us, but it's relatively easy decision to make, right? It's like, well, no one's going to do this. Everyone's going to stay home, whatever. Now we're trying to decide. So if we flip the switch back up, we'll see a huge spike, no question about that. How how do we gradually let it back up? Who do we let go back to work, right? I mean, right now, a lot of talk about letting construction go back, and the argument being construction drives the economy. And, and for some construction, it's done outdoors and lots of space, so it might be safe. But then there's other construction, which is indoors, where you have teams of people working on stuff. That's a little bit harder. I'm thinking about like the food service industry. That's a lot of low wage people. Those are the people who are most likely to not be able to afford their rents. Large segment of the community. We know that in recessions, when people lose their good paying jobs, a lot of them kind of fall into the food service industry. Well, food service is being killed right now, right? I mean, not only are people not being able to sit down, but I was looking at the numbers, even for fast food restaurants, their traffic has hugely decreased because people are staying home, right? And they're not working, right? I mean, people who are busy and running around, they often go to fast food because that's what they have time or money to do. But when you're not working and you're not running around, then that's a big, impact there. But, I think, boy, I'm so glad the president did not open things up. For Easter, we're nowhere close, right? You saw Pierce County numbers are still going up. The school's been canceled for the rest of the school year. Are they going to be able to open in the fall? We don't know. It all depends what we do with this curve. Like if we can bring it down to a good level and just kind of keep it here, then we're going to be able to feel more confident that we can release, relax some things. Or maybe what we'll do is say open construction, see what happens. We'll probably bump a bit, but as long as it stays manageable, maybe we open food service, And part of the challenge is this delay will be about 2 weeks, right? The incubation period of this virus is about 2 weeks. We probably need to wait 2-3 weeks, see what happens. But I'm sorry that's not a satisfactory answer, but it just tells you the challenges we're looking at.
Okay, so I'm going to do one more question from the chat, and then I'm going to give an opportunity to check in with some of the people on the phone. So this next question from chat is from Richard. The question is there any early report card on the temporary care center on Hosmer? Have there been any issues?
So right now, no issues with it. We only had one person there, right? So as I said, if you know of people and do get the word out that if they need this facility, it is there. If we do not continue with the contract with MDC on the temporary expansion site, we will have to find a place for them to go. Some of them will probably be fine at the temporary care center. We're looking at other options for people who would have needs in terms of mental health or substance abuse issues. The temporary care center is not set up to manage people who have significant problems with either one of those. So we're looking at other options, but the temporary care center right now is working very smoothly. We just could use more customers.
Okay, great. So at this time, I'm going to give an opportunity for any of our participants that are currently calling in from the phone. So it looks like we have 4 participants who are calling in from phone. And so if any of you are interested in asking a question of Dr. Chen, at this time, feel free to unmute yourself by pushing *6. If you're not currently muted, then that will mute you again. So that toggles mute and unmute. So *6. If anybody would like to ask a question, now is the time. So please introduce yourself and then ask your question.
My name is Blossom Croman. I'm from South Hill in Puyallup. I wanted to know how you are going to, I have two questions, how you're going to let the public know that these services are available now. And the other question I had was, you had mentioned you're doing your own assessments. Is that going to be on site? How does somebody get hold of you to make an appointment to get an assessment to see if they can stay there or if they qualify? And those are my questions.
So right now, in terms of how we're letting people know, is that we're working through the healthcare systems. We're working through some of the human service providers in the area. Um, and as we go along, well, it's one of those, I think it's no different than when you open a restaurant, open a business. You don't know what's going to happen once the doors open. We want to take this slowly. We want to make sure everything moves slowly. I know the community had concerns about, potential issues with people who are staying there. So we want to be very careful about that. So again, if people, um, we would encourage all of you, because you have connections in the community, to get the word out. I do not have the phone number offhand about the what our intake number is. You can always call the main health department number. Um, what I can do is I can find out the best number to call over the county's emergency operations center, and I'll send that to Eric. How about that? And then Eric can get that out to everyone.
Oh, terrific. Yes. And the assessments, how do people get the assessments then? Where do they go for that?
So the assessment, a lot of that's initially just a screening, just to, for example, I mentioned, there may be some people with um, significant mental health or substance use issues, or maybe they have significant medical problems, right? So this may not be the best place for them. Because, as I said, basically the idea is once they check in, they go into their room for the duration of time that they're there. You can imagine if someone, for example, has bad asthma, we probably not want them, kind of isolated in a room without significant contact. We're thinking about how we modify some of those procedures. Um, we had some meetings today with some behavioral health folks, because there may be some people who say have mild depression, or, and they're on medication and they're fine. So we probably need to modify some of our protocols just to make sure we check in on them, once or twice a day and things like that. But that's the level of assessment. It's not like they get a physical exam or anything. It's more of a screening to make sure they fit what we think would be a safe candidate to be there. Um, and so, as we go along, we're continuing to look at whether we're too stringent on those criteria, because it serves no one if we're keeping people out of it when they
Correct.
need it. We just want them to be safe, and we're slowly going. We'll learn as we go along with this.
Okay. Okay. Thank you.
So before we take another phone question, we did have one clarifying follow-up from a previous question. So in regards to the temporary care shelter in Tacoma, is that open to all Pierce County residents? And if so, is there transportation to and from the center available?
Yes, thank you for that question. And while the original plan was to open up 3 centers, this is the only one that is open right now. So any resident of Pierce County, if they contact the health department or is referred to the health department, um, then they can come stay there. We will arrange for transportation. Because these people either may be infectious or are infectious, we don't want them riding the bus or taking an Uber, right? We also don't want to have to deal with them parking a car there and worrying about their car. It is fenced off. if you haven't been by the property, the entire property is now fenced off except for one entry point, so that we can maintain security there and also make sure people aren't walking off the site. But absolutely, anyone who lives in Pierce County now can give us a call, and we'll try and get you in there.
Fantastic. So again, I'm going to open it up. If anyone who is calling in to this meeting has any questions for Dr. Chen, now is a great time to ask that. If you are currently muted and you'd like to unmute yourself, you can push *6 to unmute. Alternatively, if you don't have anything to say, you can mute yourself again by pushing *6. So if there's anyone else with questions, now's the time.
Yeah, this is Paul Cromie calling here in Tacoma. Question there for Dr. Chen. Yeah, in Tacoma here, we have a construction site that is building apartments. Now, under the governor's discretion, allowing building construction to continue on, the construction is supposed to be for public housing. And I don't know how much leeway there is on this or not. It seems to me that the city of Tacoma is looking at this as being affordable housing. This is what city staff has told us. 20% of this apartment complex that's under development right now will be affordable housing. Construction personnel is coming and going from this here site. They go to Fred Meyer's for lunch. We've seen them go to McDonald's before, 72nd and Pacific Avenue. So we're seeing this construction site continuing on. We see the health department continuing to try and prevent the spread of this virus. And yet the city of Tacoma is allowing this development to continue on and have a potential of spreading the virus. And it just doesn't seem like we've got everybody on board on preventing this virus.
I think what you're addressing is really about, and there's some pragmatism to it, right? You know, why are we allowing grocery stores to stay open? Right? I mean, the concept there is there's certain essential functions that need to continue. My understanding is that there was decision made at the state level about allowing, buildings exactly as you described, ones that were building affordable housing as important to continue. So yes, in the best of all worlds, everyone stays at home if your objective is to decrease the spread of this virus. But we also know that if we were to shut down grocery stores, people would have no food, right? So I think that may be a more obvious situation than the building the affordable housing. I think those are some trade-offs that we need to make. I think also if you look at, I would hope that when they're doing these, they continue these construction projects, that they're maintaining social distance and taking precautions in that way. So, that's, I'm okay with that if they're doing that, right? And, and same thing with if they go to Fred Meyer's, as long as they're observing the usual etiquette and things like that other people are doing when they go to Fred Meyer's. I know that last time I went to Fred Meyer's, the store had set it up. Well, first of all, it wasn't that full, right? But second of all, they, like at the checkout counters and at various places, they had set up the spacing. They had, I like to use the self-checkout, and the Fred Meyer's I went to, they had closed some of them. I think like every other one was closed so that people were further apart. I know some of the grocery stores have turned their aisles into one-way aisles so that these people aren't crossing each other when they go by. So I think everyone's taking precautions. As long as they're taking precautions, I think that's good. I mean, I have less issues with them exempting certain construction projects than I do with, I mean, you've probably seen too. I mean, I see these groups of young people out there, they congregate in some of these parks and they're drinking and, smoking and hanging out together. That's what I have more concerns about.
Okay, so as a quick just kind of for Safe Streets attendance sake, could the person whose phone number ends in 1116 really quickly just say who they are? Oh, fantastic. We figured it out. So this is, we have about 10 minutes left for the Q&A portion. So this is kind of the last chance for if there's anyone who's either calling in or would like to submit questions through the meeting chat to ask any of those questions. So are there any other questions hanging out?
I'd like to ask another question if I could, please, Eric.
Yeah, please.
My name is Carol Wright. I'm from Graham Kapowsin Community Council. My question is, we've been told that if a person were to dial 211, they would be able to have services directed in Pierce County. So if someone were to call in with COVID-19 questions, would that be a good, safe way for them to get to services?
Now, if they had questions, we would encourage they go to our website or to call the health department. And as I said, I will get to Eric there. We have a call center activated at the Emergency Operations Center, but there is a COVID kind of hotline if people have questions around it. That's a little different than my understanding of what 211 will do. 211 is more connecting people to services, but if they had COVID-19 questions, then that should come to the health department.
Okay, and Paul, you had another question.
My name is Carol Wright.
Oh, sorry, let's go with Carol.
I think she left the meeting. That's what that was for. She just asked her question.
That makes a lot of sense. Thank you so much. So, Paul, go ahead.
Dr. Chen, what we're seeing is these businesses are closed down. And specifically here, the hospitality industry, our restaurants, our bars, are putting pressure on liquor control board, our liquor cannabis control board, of allowing mixed drinks on the go. In other words, you order your drink and they'll put it in a cup, a mixed alcohol drink, and then you can pick it up with your food, or you don't even have to have food. Our Tacoma City Council voted on this to have a letter in support of this sent to the Liquor Cannabis Board and also our governor. And we're seeing how businesses are twisting things around and are really not looking at safeguarding our community. How can we fight this? In other words, it's just like this incident here with the hospitality industry, and our city council now is voting. They voted to send this letter off in support of this. We're going to have more DUIs then. It's obvious. We're going to have more fatalities, more people injured from drunk drivers. There's no oversight on this. There'll be mixed drinks on the go, and I'm concerned that we're going to see this permanently if they get this passed. Your thoughts on this? Anything that you might be able to help us out to maybe prevent this to continue on?
Yeah, I think that you've identified some concerns about this. We know that access to alcohol does increase the risk of adverse outcomes from alcohol. There's kind of a, well, there's actually kind of a trade-off here, right? So if you think about it, the number of people going to bars right now is much lower, right? I mean, the bars aren't supposed to be open. So from a public health standpoint, that means that there are less people consuming alcohol. On the other hand, if everyone's going to Costco and buying Costco-sized bottles of liquor and drinking themselves silly at home because there's nothing else to do, we might have a different problem, right? So, but this is an area, certainly, as you identified, that the health department does not regulate. I think those are valid concerns that you should bring up with your elected city officials. And, you know, I think also depends whether these people are consuming it while they drive home or whether they're taking it home and drinking it. I know that I saw an article in the paper that some of the restaurants, because it's not legal to sell the mixed drinks, they're selling you the ingredients to mix your own drinks. Right? I mean, they can't necessarily sell you the alcohol, but they can sell you the other ingredients that you can then take home and mix it. So that would avoid some of the concerns you're talking about. But yes, I would be concerned with people driving around with open containers of alcohol and drinking it while they go home.
Thank you.
Okay, are there any other questions for Dr. Chen before we end the Q&A portion? And this can be for anybody either calling in or that is on their computer.
Yes, I have one other question. I'm sorry, did I interrupt somebody?
No, go ahead.
Okay, this is for Dr. Chen. So in the screening process, if you discover that a person's health acuity is more than what this care facility is going to be able to handle, do you make a referral to the hospital then, or do you just send them back home, or do you refer in home health, or what are the other alternatives for people that you feel are not appropriate for that care center?
Yes, ideally, that's what we would be doing. We would, again, this is an evolving process. We don't know how many people would fit in that situation. There may be other ways to manage that, as you point out. Right now, we're not doing the direct home health referrals, but that would be something that we would discuss and maybe engage their primary care provider. You know, I think for the majority of people who have these chronic illnesses, they should have some source of care. I think the group that we worry the most about are, for example, those living homeless who don't have a good source of care. You know, so we are exploring other options because we want to make sure that you know, people in the community have the resources. But I will make a note to remind my staff that if they're not thinking about these referrals, that they need to.
Okay, thank you for that.
Hey, Eric, if there are no other questions, what I would like to hear from the group, either on the phone or in the chat, my question earlier about when we are to start reopening the community, and like what are either some of the sectors we should think about doing first, or what are some of the considerations that we should have? I think that would be helpful for me to hear from your audience what they think we should be thinking about when we make these policy decisions.
Okay, so for everyone in chat and everybody on the phone, again, the question is, as we look into reopening, what are the sectors that should be possibly open first, or what are some of the considerations that the county should keep when starting to reopen things?
Eric, this is Paul Cromie.
Yes.
Hey, Dr. Chen, I'm glad you brought this up. because we do have to start looking at opening up businesses and industry within our Pierce County, get people back to work before they permanently lose their jobs. This is something that we definitely have to look at. And, you know, if the health department is concerned on situations, I think safe distancing in a restaurant to gradually open up. You look down along the waterfront, outdoor seating. If the tables are 6 to 8 feet apart, they should be able to be opened up and have customers in there. If there's an industry down on the Port of Tacoma where the workers are 6 to 10 feet apart, where when they're working, they should be allowed to open back up and continue on. All those need to be put into consideration. But we do need to start looking at getting people back to work. We have a lot of people have lost their jobs, and not just temporary. There's a lot that are permanent, or maybe 3 or 4 or 5 years out. You look at the airline industry, and I feel so sorry for those pilots and stewardesses, ground personnel.
Great, thank you. Anyone else?
Yes, one big concern that I have, once you do start slowly opening things up, like Paul said in reference to the restaurants, how can we be assured that the restaurant workers that are coming back to work are not asymptomatic and shedding virus? I feel like increased testing needs to be done on those services that we're going to be opening up again, so that everybody who does go back to work, we can make sure that they are not positive for the virus and just not showing symptoms and will not be spreading it. So I think increased testing of those who go back to work is going to be really important so that things don't spike again. And do we have the capacity to do that number of testing?
Okay, great, thank you.
And then we have a couple comments in. So from Connor with Safe Streets, his input is, my first desire would be to be able to travel again to family and friends, and then normal comforts such as restaurants, stores, and haircuts. Then we have a comment from Mary Beth saying that construction seems like the appropriate way to start with social distancing. If there are no other inputs or comments for now, we can definitely be able to collect those even after this meeting, and then I'll be sure to send them your way, Dr. Chen.
Mm-hmm. Thank you.
And so we have reached 5 p.m. So if there's did you have any last comments or anything that you'd like to give, Dr. Chen?
You know, I just want to say
thank you very much.
Yeah, thank you. And in fact, I want to thank all of you for the work you do in the community. I know that when we were setting up, we're looking at opening temporary care center, Safe Streets was very critical in helping connect us to the people, and not only helping us hear what people were concerned about, but then also making sure that we were communicating with the community. So thank you for what you do, and thank you for, and not just on this COVID-19 issue, but so many other issues that we put on the back burner because we're so overly focused on this. So we want to thank all of you, and thank you for the opportunity to be able to speak with you.
Okay, thank you so much for coming to this, Dr. Chen. I know that this was really valuable for me. And so feel free to stick around if you want to hear kind of what some of the other groups are talking about, or any of the other kind of regular Safe Streets updates. But otherwise, thank you so much for coming.
Great. So I'm going to hang up now, but if you have anything else I can help you with in the future, just let me know.
Okay,
Thank
that
you,
sounds
Dr.
great.
Chen.
Thank you.
Yeah.
Thank you. Thank you.
Okay. So with that, we're going to move into the more typical group leader forum aspect of the meeting. And so for now, I just want to let everybody know that, again, as I said at the beginning, you're free to leave anytime. You're free to stay for as long as you'd like to. This is really just an opportunity now for Safe Streets to be able to make some announcements, and then also for you as group leaders to be able to share any of the needs, updates, any information that you'd like to share with one another. Because again, everybody in this meeting is either a group leader or connected to Safe Streets in some kind of significant way. And so at this point, it is also okay to unmute yourself if you have something that you'd like to add. We are going to, though, continue to mute yourself as much as possible when you're not actively speaking, just so that we can minimize the amount of crosstalk. So to start with, we are going to do some Safe Streets updates first. And so for that, I'd like to turn it over to Wanda, who's going to talk a little bit about the census.
Okay, thank you, Eric, and hello, everybody. You guys are amazing to me, and we really do appreciate your support and the support that you give your groups and the community. So really, census has already started, and I just wanted to remind people, if you haven't already done it, go online and fill out the 10 questions. You don't need a code. You can just go to the website and then put your information in. So I'd love to be able to do a little poll, but to see who's done it with thumbs up, but that's a little challenging for me because I'm old and this is technology. So I've had to learn a lot. So anyway, yeah, just, again, just complete the census, please. It's really, really, really important, and it's going to help guide the future of our community. So that's really all I had to say. Thanks, Eric.
Awesome. I can say that I did the census and it was even easier than I expected. So there's no excuse for anyone. So an announcement, some other, oh yeah, go ahead.
Wanda, I did on the 3rd, but they sent me a letter too. Don't forget. So just like everyone I did after the 1st, yes, I did receive a letter from them.
I actually got 2 of them, and I don't know, it's just for me and my husband. And I mean, I guess it was every individual, so it would make sense to get 2, but yeah, so I did use the code, but I know you don't have to.
Yep, it's just simple and easy, just simple.
Mm-hmm.
Thank you.
Thank you for that, Darren. So some of the other Safe Streets updates that I was just going to give out really quick. If you haven't heard already, it is extremely upsetting to hear, but National Night Out has been pushed back. So the date of National Night Out is now Tuesday, October 6th. So it's not going to be until October 6th. I think that's the right date. It's not going to be until October. It is no longer happening in August. And I just confirmed on my calendar that yes, October 6th, which is a Tuesday. If you had already registered your event, then I believe Caitlin already sent you a message letting you know of the change. If you have not registered yet, registration is up on the Safe Streets website, so feel free to access it during that or in that way and register your event. The next thing is that at Safe Streets, we mobilizers, obviously our jobs have been a little bit different during this time, working from home. A lot of groups have not been meeting actively, but we do want to let you know that as you can see here, we have the capacity for online meetings. So if you are interested in trying to rally your neighbors in order to have an online meeting, your mobilizer is available to help you get that set up and facilitate. I know that we have already had a few online meetings with neighborhood groups so far that have been very successful from what the mobilizers say. And so we really just want to encourage that if you want to continue meeting, because we don't know exactly when this quarantine is going to end, we do have the capacity and we are very, very happy to help you. We would really appreciate the work. The next thing that I just wanted to let everybody know is that there are still a lot of different volunteer opportunities available because of COVID-19. So a lot of schools have been doing free lunch programs that they've been handing out meals. And then there's also a lot of food banks that have really been hurting for volunteers. And so there are volunteer opportunities, and we have our Safe Street staff member, Sarah Dubois, who part of her role is shifted so that she is also our volunteer coordinator. And so if you have any questions, Sarah is more than happy to answer those questions and to get you connected with those volunteer opportunities. She is here in chat, and so feel free to message her if you'd like. Otherwise, you can always contact her over email. The last update that I wanted to give from Safe Streets is that we have been, so 2 of our mobilizers, Connor and Alberto, have been working together to produce a new Safe Streets video every week that we have been putting up on our website and through our Facebook, and I think also through our emails if you get emails from Safe Streets itself. And so they're really excellent videos. They've been on a number of different topics, including the census and 10 safety tips. And we're really proud of the work that they've been doing. So we just wanted to let you know that those are available and to encourage you to watch them. So with that, it looks like our attendance has gone down a tiny bit. So I do want to open it up.
Right.
If there are any group leaders here who are interested, or anyone interested in providing any updates, now is the time.
Eric,
Yes, please, Derek.
Another announcement. If you're the group leader, the core group is planning to do something, have amazing story to share, please also contact Julius too. Julius is on there too. They would love to share your story with the other. For example, like Spring Hill, they went out there and painted the mirror on the fence, and like Paul and Amy clean up, walk around the neighborhood and pick a little in the neighborhood too. Just those kind of really good story.
Yeah, just let me know. This is Julia.
Okay, so are there any group leaders or members or anyone else that has any announcements, any needs that your community or neighborhood has, any updates or fun stories that you'd like to share with everyone here?
This is Mary Beth in Prairie Ridge and White River. I've done the census, Wanda. I'm good to go. So just a couple of things out in Prairie Ridge. We are continuing to do our community dinners, which we do every week on Wednesdays. We feed typically when we're in the building 70 to 85 people. It started going up a couple of weeks ago. Because we're doing drive-by meals now, so it's easier for people to just come through and it's safer. And we went, one week was 75, the next week was 84, the next week we had 104 meals served and we had 12 cars without food. And we served 140 meals last week. So we're seeing a significant need change in our community. Maybe not a need change, maybe people are just now seeing Facebook more or hearing from people that services are available they didn't know were available. We're unsure. But we have to make a run to find more to-go containers, and I feel like cash and carry might be a problem, or whatever it's called now. So if there are to-go containers like a styrofoam clamshell, like the 9-inch size, compartmentalized, are great, but not mandatory. But anytime we can get those, they're a little bit expensive, and we've got some funding through Greater Tacoma Community Foundation. But we just, if anybody sees them and can let me know where they are, I'd love to go get them. That's one thing. And then the other thing, I have my National Night Out registration done. I am bummed out about October because because it's just going to be hard to do 200 people in our building. It's going to be, I think it's going to have such a horrible impact, but I get it, but it's just a bummer. And then the last thing is, we like to hand out resources. I'm handing out resources through the meal programs for Sumner, Bonnie Lake School District, and I know White River is handing them out, and Ording is handing them out at their lunches. And if Safe Streets wanted to put together some sort of one sheet or half sheet that said, hey, quarantine doesn't mean you're not a neighborhood. Here's ways to be together when you're apart. Here's ways to be a safe community. What a great opportunity for us to hand out a resource to them to make them aware of Safe Streets, to remind them that they can still, check on neighbors from porches, that they can still care for one another. If you guys had an opportunity to put something like that together, I would take it in a heartbeat.
Okay, it's good to know. And Mary Beth, I know that I've purchased to-go containers at Cash and Carry, which I guess now is Smart Food Service. So I don't know if you've tried looking there or they're out.
Well, I'm headed there. The last time I was there, they were getting pretty low. So I'm going to head there tomorrow and see kind of what they look like. But I just thought if people see them out there, I'd love to know where they are, just because driving around, it's not my favorite thing to do. And going into 5 stores is not my favorite thing to do.
That's actually my highlight since I'm working remotely, is going to the stores. And the next time I go, I will also take a look at Cash and Carry for you.
Thank you.
All right, thank you so much for sharing, Mary Beth. That is extremely impressive how many people you've been feeding, so really good for you. You got a shout out from Emmy in the comment section as well, just saying shout out yay for serving that many people, so it's really good work. Is there anybody else that would like to share anything about their groups or any needs?
Hey, Paul. Hey, Paul, are you still there? Paul? I just want to speak. I talk to Paul more often, and every time you take your vehicle out, please drive around and patrol. Just like when you drive around, you like patrol your neighborhood right there, because the criminal take opportunity. But this time while we are locked out, there's people complain on Facebook too. So please, every time you take your vehicle out, take different route. That's it. That's what a Park Jack Avenue group they have been doing it.
Eric, are you still there?
Yeah, I am still here.
I'm sorry. Yeah, what Darren said is something that we have really had to step up in our neighborhood. We have seen a lot of more suspicious activity, and we did have a huge increase in crime in our area last December and into January. So what Darren is saying is exactly right. We have needed to step up our patrols, and especially coming and going where if we're going to the grocery store, everybody is taking different routes. Rich Gardner, our leader, he is walking the neighborhood several times a week, early in the mornings. I do a walk around in through the neighborhood before it gets daylight or right at the crack of dawn to see what's going on. And we're out there observing and watching probably 50% more, I'd say, than what we were doing a year ago, because we're seeing a lot more suspicious activity. It just seems like, I don't know why all of a sudden we've got we have an increase in junkies and drug activity in that 72nd and Pacific Avenue area. And so they filter off into the neighborhood. So everybody needs to be aware. I think a lot of criminals are taking advantage of the situation too. Fred Meyer's 72nd and Pacific Avenue, they are at their wits' end. Theft at that store took a big jump up. Thieves now have adapted to covering their faces with a mask or a scarf. And so they go into the store and their identity is hidden right away. So they can't see who they are and see if they're a repeat offender. So these things we need to be aware of. Just be careful out there. Be aware of the neighborhood. Make sure everybody is safe.
All right, thank you, Paul. And so one comment that did come in, speaking of Richard, from Richard Gardner, is that Tacoma City is evaluating community cleanups and will likely be canceled. I'm not sure, Richard, if you had any extra information that you'd like to provide. Otherwise, I know that I had heard a little bit about that as well.
Yes, I can provide some information. You hearing me now?
Yes, thank you.
Okay. Community-based services is going to be talking with solid waste on this, and they've already canceled the earliest of or postponed the first cleanup. So there's really no time to do this. The volunteers don't really want to be involved. I've had several folks tell me they're not interested. I'm encouraging the city to look at alternatives like additional call to hauls. But related to that, am I walking about with everybody being at home? There is more garbage at the homes, which means that the trash cans are overflowing. We're seeing a lot more garbage just blowing around from overflowing trash cans. And it's just looking like blight. At the same time, a lot of folks are taking the opportunity to keep their houses up and are doing little projects around their houses. So some places are looking better and other places are looking worse. And as time goes on, and people with not getting a paycheck anymore, we just need to live with it and adjust as necessary.
Yeah, okay, thank you for sharing. And so we're coming up towards the end of our time. And so I do want to make sure that if there's anybody else, either group members or Safe Streets employees who have anything else to share, now is the time.
I just have one question. I think I might have missed something. You talked about Connor and Alberto doing the weekly videos for Safe Streets.
Yes.
And how do we access that?
That is a great question. To my knowledge, I believe that they're on the website, on the Safe Streets website, but
Okay.
I would love it if either Connor or Alberto or Julia were able to jump in and say specifically where they are.
Yeah, they should be. They're being added to the front page of our website. If you go there and then you scroll down, at the very bottom, you'll see kind of a row of videos. We've got the first one up there now, and there are 2 more, so they'll be added there shortly.
Okay.
Are they also on YouTube?
Yes, thank you, Wanda. They're also on our YouTube channel.
Okay.
Let me go ahead and put that in the chat so you all can subscribe.
Okay.
I would like to clarify, this is Connor. The plan was to have them weekly, but we started that plan when we were still in the office and had access to each other and more open environments. So with footage being a little bit more difficult to obtain, it's not going. I don't know how many of you are actually going to plan on following us and expecting a video every week, but it's not going to happen.
Well, it gets kind of boring staying at home, you know. Okay. So is it called 10 personal safety tips for your everyday life? Is that one of them?
Yes.
Oh, okay. Okay. All right. That's all I wanted to know. So I know how to access now. And we can recommend our neighborhood groups to look at them if they want to.
Yeah, by all means.
Yeah.
They're there for everyone to enjoy, whether they're members of a group or not.
Okay.
So, Connor, you want to share what the second one is about?
So the first one is the one that you just mentioned, where we do personal safety tips. The second one is on package safety, especially, which is kind of important now since we are almost required to have everything delivered to us.
I don't see that one. I'm sorry for interrupting, Mrs. Emmy. I don't see where that one is. I'm at your website right now.
Sorry, Emmy. We're still getting those up, the 2 newest ones up on the website, but I did send in the chat a link to our YouTube page. Or if you go to YouTube and just type in Safe Streets Campaign, you'll find the channel, and that one has all of them too.
Okay, groovy. Thank you.
Yeah.
Thank you.
And then the third one, which Julia, I believe you just uploaded today or Friday, is a short little commercial for the census. So if you hadn't done it, now we have a little minute-long thing reminding you again to take it if you haven't taken it yet and are not sick and tired of us telling you to take it.
So if I may be so bold and understand that I'm not the one doing the work, it's the team that is doing the work. But I think that if you have topics of interest that we can help create a video around or do something. And when I say we, I mean, Alberto and Connor and Eric and all of the other mobilizers. But I think, it'd be great to know if you had a topic that we could maybe do a short video about. I don't know. What do you guys think? Connor, Eric, and Albert.
I'm perfectly happy to do that. We put that at the end of the not the commercial, but the other 2 videos. If there's anything that they specifically want emphasis on, we're trying to break down the things we normally talk about in some of our presentations and whatnot.
Right.
But if there's something specific that you want us to have focus on, maybe produce it first, or maybe it's something we haven't even thought about. Certainly would appreciate the input.
Okay.
And so I want to go ahead and share something that, so another part of this is also if your group has been doing anything in order to address the needs of your neighborhoods during COVID-19, this is also a great opportunity to share them. I see Emily Bosch lurking in the guest list, but hasn't said anything. And I just wanted to volunteer that Emily and her neighbors made a really excellent newsletter for their neighborhood. And in the newsletter, they even had a section for specific group members, what resources they were volunteering to be able to provide or help acquire for any neighbors that weren't able to get those resources for themselves, like toilet paper, food, all of those types of things. And then on the back of the newsletter, they also had a really excellent bright red sign that people could put in their windows to say if they had any needs. And so that's just an example of a really cool way that you can keep yourselves busy during this time to try to engage your neighbors. And your mobilizers are, of course, more than happy to help you with designing or printing or whatever your newsletters. Okay, is there anything else that anybody else would like to share before we call it a day?
Eric, thanks
Yes.
for your kudos on that. That's very kind of you. I have to give credit to the neighbors that actually came up with that idea. It wasn't me. But I would say that one thing that I've learned from doing that is to double check and make sure that if people want to do the thing where neighbors are offering help, make sure that the neighbors who offer the help are okay with what is being published in the newspaper. Because there was one neighbor who I assumed that was the case and it turned out not to be true. And she's fine. But just double, triple check with people. Are you sure this is what you want to offer help with? Are you sure you're okay with your information being put out there? Just to keep that part safe too.
That's a great tip.
Yeah.
Yeah.
So our neighborhood is a PCNet neighborhood, and so we are using our emergency phone list, and so we are contacting people about every other week, either by phone or speaking to them out in the yard if we see them from safe distance, just to check and make sure everybody's okay. And if people need help with grocery shopping, then they can make it known to us and someone can help. But the PCNet also has the help sign that people can put up in their window in case they need help. So we have been keeping in touch, and there's 3 people. We've got our neighborhood divided up into 3 sections. So each of us takes one section, and those are the people that we maintain pretty consistent contact with, so we can make sure everybody is doing okay at this time.
That's really great. Anything else? Okay. Well, then in that case, we're almost perfectly on time. So I just wanted to thank everybody for tuning in and contributing to this discussion. This is obviously a very unusual time, and I feel like everyone is doing a really terrific job trying to be adaptive, both to the situation and also being responsive to the needs of your neighborhood. So really good job to everybody. If you have any questions or any needs that come up, again, please contact Safe Streets or your mobilizer, because we're more than happy to help. And then the last thing is that I have been recording this whole conversation, and so this whole meeting. And so the goal is going to be for us to post a link to the recording on the Safe Streets website. I need to consult with some of staff to make sure what the best way to get the information out to you is, because perhaps a 2-hour-long recording is too big for our website. So regardless, I will make sure that I get any further information from Dr. Chen, as well as how to access this video out to all of the attendees today. And if you have any further questions or input for Dr. Chen on, what you think they need to keep in mind as we're trying to reintroduce everyone's society to normal life, please send those my way and I'll make sure that it gets them. Other than that, thank you all so much for coming, and I hope that you have a terrific rest of your Monday.
Thank you, Eric. Great job.
Okay.
Thank you for organizing this.
Have a good night, everyone.
Hey, bye, Connor.
Good night.
Happy Cambodian New Year.
Multiple people are now exiting.
Bye.
See ya.
Blossom Croman
is now exiting.
Okay. How do I stop recording? There you go.